Welcome once again to another of the series of Ask the Doctor. Um, I'm Dr. Wale Okedino. I'm a qualified medical practitioner of about 45 years standing. Uh, I've been practicing as a family physician for this number of years. So, as usual, I will be taking some questions sent by my patients, and then we will discuss the answers together. The first question is from a gentleman who complained that he has a low sperm count. According to him, his latest sperm analysis showed that he has a very low sperm count. He now asks me on what he can do about this problem. And my answer is that low sperm count, which we call oligozoospermia in medical terms, uh, can be caused by different factors. Some of them are things that are in the way the body was formed. Maybe there's a blockage in the vessel that is carrying the sperm from the testicles into outside. There could be problem with the testicles themselves, so that development of the sperm are affected. And then there could also be some lifestyle problems. Uh, it is been confirmed that because the sperm production needs a cool environment, it's always nice to for the male, for the man, to have the testes in a cool environment. That is, people with occupations where they are exposed to heat, unnecessary heat, may also have problems with their sperm counts. So, and also some underlying infections, maybe the ones that were contracted during sex. What we call sexually transmitted diseases can also cause a low sperm count. And then there are some medications that people have used over the years, or excessive intake of drugs or alcohol, or the smoking of some very caustic material. All this can also lead to low sperm count. So how do we handle this? We can do this when the doctor takes a sample of the semen and looks at it under the microscope, or then incubates it in the laboratory. They can pick the kind of organisms that is causing an infection, if it's infection. And then they can also analyze the specific antibiotics that can be used to clear this infection. So you will need to have a sperm analysis done through a doctor in a laboratory before we can confirm the kind of infection that is causing a low blood count, and then the drug that we used. We can also improve the situation by adjusting some of the lifestyle habits. For example, those who smoke a lot or take alcohol can be encouraged to either stop smoking or stop taking alcohol, or to reduce to the barest minimum. All this. It's also important for those who are on the big side, who are very fat, to reduce their weight, so that you can reduce this problem. And then stress, those who are under stress, or those who occupation entail like long distance drivers, truck drivers, long haulage drivers, or those who are always sitting for a long period. All this can be reduced, so that this problem can also go down. And then we also have, I've mentioned medications. And in situations where the low sperm count is due to a blockage of the sperm of the vessel that is carrying the sperm. Surgery can be done. Some operations can be done to release this obstruction. And where there are difficulties after all this treatment, some sample of the sperm can be taken from a man and then artificially introduced into the partner or the wife if they want to get pregnant. So these are some of the areas that are needed to be looked into if you want to tackle low sperm count. So I go to the second question. This second question is from another young man who noticed some blood in his stool. According to him, the question goes like this: kindly let me know what causes blood in the stool. I have been noticing a bright red blood in my stool for some time now. Yes, so now that he has described the blood, he said it's bright red, because there's a difference between noticing blood that is bright red and one that is dark. Bright red color means that what is causing the bleeding in the stool is very close to the anus, which means that the blood is fresh, it's just dropping from the anus. If you have said that the blood in the stool is dark red, then we will have guessed that the problem is up in the intestine. So by the time before the stool comes out of the body, you have to travel for some time, and then the blood will have changed color. But when it's bright red, our mind will go to something that is close to the anus, and the first thing that comes to mind is bile, what we call in medical terms hemorrhoids. These are the commonest causes of bright red blood in stool. It's important to know that hemorrhoids can be internal, and that is, you can have them without seeing them. They can be inside your anus. And how dark or bright the blood is will give you the idea of how serious the situation is. Like I said, darker blood tends to point to something more serious. That is something coming from inside the body, so it can be more serious. While bright blood is usually from the hemorrhoids or from intestinal ulcer, maybe a bleeding ulcer in the intestine. And then how often it's happening is also important. If somebody is having it regularly, then that means that that problem is been going for some time. But if somebody just notices it once in a while, it means that the problem is coming off and on. And in both cases, the important thing to do is to first of all see whether you can manage this issue yourself. If you are having constipation, if you know that before you can stool, you have to push or you have to strain yourself to pass the stool, and you are constipated, what you can do is to increase your the water you drink, increase your vegetables, increase fruits, take things that will make your stool to be light, so I don't have to strain again. You won't be constipated. And then some people can also take some laxatives that you can buy across the counter. Some of these liquid paraffin that you can just use yourself. You can buy it across the counter from the pharmacist. You take them and see. If this one works, then you know that you have taken care of the problem. But if despite this, the problem persists, then you have to see a doctor who will examine you through your anus and see what is causing the blood. And then a diagnosis will be made, and then decision will be taken. Whether you take blood, whether you take medicine to clear it, or whether there will be a small operation to remove the bile or what is causing the bleeding. Then the next question is from another gentleman, and his own concern is whether he can eat eggs at his age. He said, I'm a 65-year-old man. I want to know if I can still be eating eggs every day, because there's a lot of misinformation out there Some people believe that egg should be stopped. You should not be eating it when you are old. But medically, eating eggs at the age of 65 or even at older age is generally considered to be safe and very beneficial because the egg is a very good source of protein, and it also has enough vitamins that the body needs. For example, one egg will give you about 6 grams of protein, which is considered necessary for a day. So that's why they usually say an egg a day keeps the doctor away. When you eat one egg a day, it gives you the essential protein that you need. Eggs are also a source of nutrient-rich food. They provide essential protein, vitamins, and minerals that can be particularly helpful for older adults. However, individuals with high cholesterol levels or who are susceptible to heart disease should consult a doctor before they continue taking eggs. But once you don't have a history of high cholesterol and you don't have a history of heart disease, egg is very good at any age. It is recommended as a source of protein and vitamins for the body. Then another question is on he has hemorrhoids. He has been diagnosed to have hemorrhoids, that is bile, and is asking that can I cure my hemorrhoids naturally? That is, what can I do to cure it without taking medicine or doing operation? And my answer here is that it depends on the type of hemorrhoids you have. We have a first degree, hemorrhoids come in degrees. We have the first degree one where you don't even see the hemorrhoids from outside, it's inside, and you see only blood. And then there are some hemorrhoids that when you go to toilet to defecate, to pass through, the hemorrhoid will come out and then it will go back inside by on its own without any effort. That is another degree of hemorrhoid. Then the third degree of hemorrhoid is the one that comes out and cannot go in on its own until maybe yourself or a doctor or a nurse will help you to push it back inside. So for these three types of hemorrhoids, their treatment are different. The one that we can say you can treat by yourself naturally is the first degree one, the one that does not come out at all, that you just see blood. The moment hemorrhoids are coming out of your body, then you will need to see a doctor to assist you with some medication. And when it gets to a point when it comes out and doesn't go in again, that one is even a higher degree of hemorrhoids, where surgery may be indicated. But for the minor one, what you need to do is to increase the amount of fiber that you have in your diet so that you don't be constipated. And we usually say a high fiber diet, at least 25 grams per day. This means you will need to take what you call roughages. Take oranges, take fruits. Eat not only not only sucking the orange. You have to eat the fiber in the orange. And then, of course, take vegetables. And then, you also need to take plenty of water. Drink lots of water. And then avoid junk food. That is some of these foods that are mainly pastries, baked foods, fried foods, food that are already made through fast food joints, and they have been there for some time. They just warm it for you. You have to avoid those food because those kind of food, they don't have enough fiber to make you go to toilet easily. Eating this food regularly and drinking carbonated drinks like mineral drinks and all kind of thing can make you constipated. So you have to avoid them. Just take plenty of water. And then you should also minimize the time you spend sitting on the toilet, so that it will not get a point where your humorous will start coming out. It's estimated that within 2 to 3 minutes, you should have finished passing stool, and then you should be able to avoid straining, that is, pushing when you are trying to pass stool. However, like I said, if all this fail, then you need to see a doctor for more detailed examination. The next question is a young man who says that after passing urine, he noticed that the remaining urine will be dripping. It will drip for some time before stopping, and he's worried. And this is why he's asking this question. Well, for us in the medical profession, if this is all his complaint, I don't think there's need to worry, as long as there's nothing coming out like a discharge or blood. If it's just the urine that is dripping after the main one has passed, what is happening is that there is a sphincter, that is a little structure at the end of your tip of your penis, male urethra, that can stop passing the urine can stop the urine from coming out after. That structure closes after the main urine must have passed out. But sometimes it takes some time for it to finally close, so the remaining urine can drip out, and this is why when you wait for a second or two, the urine in that area will come out of itself. However, if you have to wait for a long time for this dripping to occur, or if this dripping occurs frequently, then you have to start wondering whether your bladder, where the urine is coming from, is having some challenges. That one, you will need to see a doctor who will do a manual examination. He can examine you by putting his finger through your anus to check the prostate around the bladder to make sure it is firm enough, or he can ask you to do some tests to confirm that one is okay. The next question is from a lady, and she's asking that he has been noticing some blood. Anytime I have sex with my husband, I will notice blood coming out of my private part. I want to know if this is what is called cervical cancer. That is a question. So my answer is that yes, the early signs of cervical cancer can include unusual vaginal bleeding, usually after periods or after you have had a sexual intercourse. These are some of the signs that you see for cervical cancer. Or you can also notice some foul-smelling discharge from the private part. Or you can also notice some pain when you are having sex. So these are important. These are some of the symptoms that you see when you have cervical cancer. It's however important to know that at least in some cases, some early cases of cervical cancer may not even show any signs, non-noticeable symptoms in some cases, and the first indication may get to a point when the cancer must have become so advanced, and that is why we always recommend that a test which we call Pap test. Pap test is a test that is done in the hospital by a nurse or a doctor or a laboratory technician can do it for you, whereby a little smear of the cervix is taken and checked under the microscope, and that one will show you whether you are having early signs of cervical cancer. And this is why we recommended that women over the age of 40 years must have regular pap smear examination. So this pap smear is recommended for women once you are above the age of 40. You should do it regularly and go to the hospital or a health center. Once you tell them not to do a pap smear, it will be checked. Don't wait until you start seeing blood when you have sex before you complain, because some cervical cancer cases may not show until it's too late. The next question comes from a 60-year-old man. He says, I often have muscle cramps. Can you let me know what to do? And my question says that when you are about 60 years of age and you have muscle cramps, there could be some causes of this. It could come from having some deficient vitamins in the body. It could occur because at 60 your muscles are becoming too lax, and then sometimes it can come maybe when you have overdone something. Maybe the fellow went for a long walk, or he tried to carry some objects or heavy load. And I said the solution is a combination of preventions and also some treatments. For example, when you notice that kind of cramp, you can try some gentle stretching. You stretch that part of the body, the muscle area, if it's the leg, you stretch it. And sometimes it can also occur when we are not taking enough fluids, that is dehydration. So it's important for elderly people, or even not even elderly people, almost everybody, to make sure that you take enough fluids every day. People have said that you should take about equivalent of about 6 pure water sachets a day, at least a minimum, to make sure that you are well hydrated. And when you have these cramps, you can do some massage, either by using some heat compress or ice compress can help you, or you can even use some of these creams that are bought over the counter. And having done this, if the cramp is severe or is coming too often, it is important for one to see a doctor who will check the body, and like I said, he will do some blood tests and see whether you have some deficiency in vitamins. And it is also important that before you do a physical examination, anybody, whether you are old or young, make sure you have taken enough fluid. And also, it's always nice to start an exercise slowly, gradually, before going to the severe ones. And it's also important to do some warm-up exercises. Like if you want to do, those who want to go for a long walk, you can start by doing a small exercise in the sitting room to warm up the body before you now go on that long exercise. Then when you finish, it's always nice to relax, allow the muscle tension to go down. And generally, it's very important to have a balanced diet, rich in fruits, vegetables, and whole grains to ensure adequate nutrient intake, so that you'll be taking enough vitamins, because many of these vitamins are available in what we eat. Avoid excessive intake of coffee or caffeine in coffee, excessive intake of alcohol, especially before bedtime, as they can cause dehydration at night. And like I said, when the cramp is happening to you, gently stretch the affected muscle and hold it until the cramp subsides. You can massage the cramp side muscle to help you to relax and improve blood flow. And then the last question on this episode is another elderly person. Is asking that I'm a 70-year-old man. I want to know if I can commence workouts in the gym without the fear of a heart attack. He wants to go to the gym to do some weight training. Well, I would say, because he's a 70-year-old man, it is not against going to the gym. The only thing is that it is important before you go to the gym to see your doctor, who will check your blood pressure and make sure that your blood pressure is not too high. Check your body vital signs to make sure that everything is in good shape before you now go to the gym. And when you go to the gym, it's always nice to start with the least aggressive form of treatment. When you go to the gym, there's something they call treadmill. This is like a carpet on a machine where you'll be walking slowly. So you can start by doing slow walk on the treadmill for about 10 minutes until your body is warm before you now go into the extra walk. And because at that age, you are not supposed to be carrying anything too heavy. You can start by carrying small weights, 5 kilogram dumbbells for stretching your muscles. Then you can go up to 10 kilogram, and maybe if your body is okay, you can go higher. But if it's not okay, you stop. When you are tired, you stop. And these exercises with the weight should be done minimally, maybe 4 or 5 times, and then you take a rest until you are relaxed. So that's one of the ways. So if you do this, you will avoid anything like a heart attack or any problem when you jog or when you walk or when you are in the gym, because you are not overstretching yourself. Don't forget that you are doing this just to improve your muscle. It's not that you are going for. So avoid rigorous exercise, engage only in mild to moderate exercises, and you'll be okay. Thank you for listening. I will see you in the next episode. Thank you.